My guest joins me to discuss his career journey and current role as software engineer at MITRE, the organization that everyone in public health should know about. You're listening to the PHEC podcast, episode 327. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. This episode is part of a special sponsored series of episodes where you'll learn about MITRE through my conversations with leaders across their organization. MITRE's mission-driven teams are dedicated to solving problems for a safer world. Now, my guest on this episode is Andy Gregorowicz. He joins me to discuss his career journey, including how he discovered public health and his work at MITRE. I think that all of you will find this episode filled with interesting and valuable insights. Let me fully introduce him, and then I'll connect our conversation. Andy Gregorowicz has over 20 years of experience as a software engineer for MITRE. Since joining, he has applied his software and interoperability expertise to current challenges faced by the Centers for Disease Control, or the CDC, Department of Veteran Affairs, and Health and Human Services Office of the National Coordinator. Andy is the Chief Engineer for the Public Health Practice, Integration, and Delivery Department at MITRE. In that role, he is involved in multiple CDC projects, including the Clinical and Community Data Initiative. When possible, Andy still likes to get his hands dirty, so to speak, by writing code. This includes working on Cynthia, an open source synthetic patient population simulator. He discusses that during our conversation. Andy holds a BS in electrical engineering from Eastern Nazarene College and a master's science in computer systems engineering from Boston University. Let's connect my conversation with Andy right now. Well, hi, Andy. Welcome to the podcast. How are you doing?
I'm doing well. Thank you for having me.
Oh, I'm really excited to, we were chatting a little bit as we were getting ready to press record and start. I could feel my questions already starting. So I thought, let me hold on for the actual recording. So I'm looking forward to getting to know you more about what you do. So why don't you start with just introducing yourself?
So I'm Andy Gregorowicz. I am a department chief engineer at the MITRE Corporation. And for those who might not be familiar with it, MITRE is a nonprofit organization that operates federally funded research and development centers. And I primarily do work focusing on public health at MITRE, but my background is actually in software engineering, and I tend to focus on system interoperability. So a lot of trying to make sure that electronic health record systems can communicate with one another or with other systems. A big area of interest for me is patient matching or record linkage. So helping us find all the information on an individual so we can gather that together to serve a number of different useful purposes.
Oh, so that already sparks a lot more questions. That's really interesting on so many levels. I love that you have that background and then you bring that into public health, which is actually where, like, one of my questions I start with, one of my favorite questions, actually, given the fact that you have this, software background and now you're working in public health. When did you first learn about public health or really consider it as a career?
It was actually a lot later in my career. So I started off at MITRE doing work related largely to the Air Force. And then transitioned over into the healthcare part of MITRE, I was very naive. And they said, oh, Andy, we have a project where we're going to test electronic health record systems and see if they can talk to one another. And I thought, oh, well, this will be a walk in the park. We've been having defense systems work together here for years. How hard could this be? And that was quite a surprise in sort of just the pure healthcare sector. And as I started to move over into healthcare and public health, one of the things that really caught my eye, and this is even prior to the pandemic, is the impact that vaccination campaigns had on just general well-being, the impact that it's had on life expectancy and whatnot. And as I was looking at that, and there was sort of a push around individual health and, sharing individuals' healthcare, I was just really attracted to the impact and the power that public health can have on communities. So then when I had an opportunity to start to work on projects that were for CDC, I jumped at that and was very lucky to be able to start to work on those sorts of efforts.
Wow, that's really interesting. That's incredible, actually, because you're in a position and you're already happy with what you're doing, and then this opportunity to expand into something new. Although probably a little scary at first when you realize what you're into.
It is scary, but it's also comforting at the same time. So I always, when I meet with epidemiologists or other folks in public health, I always put out a full disclaimer. I'm a software engineer. I'm not a doctor. I don't play one on TV or anything like that. But I find that a lot of public health professionals are really cut from a lot of the same cloth as software engineers. A lot of us are, I would put myself in the camp of being a data nerd. So there are a lot of folks within public health who are data nerds at heart. And so I think that folks from the software engineering disciplines and folks in public health can get along quite well. And we can learn an awful lot from each other. So that's been fantastic.
Oh, I like that. I had to write that down. That's a really great observation. And I like that. I like when you can find that commonality between two seemingly unconnected or unrelated types of fields. So nice. What about population or condition, or is there a public health problem that you're really passionate about now?
As far as a public health problem, the piece that I'm really interested in is connecting different bits of information. So we know that you don't just live your life at a healthcare provider, that's not where all of your information is going to be stored. The entirety of your well-being, what is going to impact your well-being or community's well-being, is going to be impacted by community-based organizations that you may interact with or maybe reaching out to you. It's going to be impacted by the environment that you live in, and that could be weather, it could be highways you live close to, it could be a number of different things that impact your health. So there is a whole world of data that we need to look at to be able to understand how that impacts an individual. And I would say looking at conditions and things that impact communities, I was fortunate enough, and we'll probably get to this, one of the projects that I'm very excited about that I've been fortunate to participate in is CODI, which is the Clinical and Community Data Initiative, that originally started off as the Childhood Obesity Data Initiative. So obesity is a topic that I'm interested in. I think it's something that we need to be looking at a complete picture of an individual or a community to be able to understand interventions that are effective and how to help people achieve a healthy weight.
Yeah, that was also part of my dissertation research.
Oh, wow.
Obesity. Yeah. There's so much work to be done in so many spaces, but, definitely in that area. You mentioned, and I'm sure we're going to circle back to that a little bit more. You mentioned that you've been at MITRE for a while. How long have you been there? And let's talk a little bit more about your role there.
Sure. So I've been at MITRE for 23 years.
Wow.
So yeah, I think it's a cool place to be. And yeah, I remember when I joined, they were just getting rid of all the Y2K project mugs. If you want to go back that far, they were trying to clear those out for all the projects that were worried about Y2K. So fortunately, we're well past that at this point. The role that I play at MITRE is I'm a chief engineer. So what that means is I tend to have my hands in a bunch of different projects. I oversee technical quality for those projects, and I'm typically working with our sponsors at CDC, helping them, sort of shape up their problem, kind of understand their problem from a technology perspective or from sort of the software engineering perspective, and then helping our teams kind of execute that so that we can deliver solutions that are useful to CDC or to the stakeholders that CDC is interested in delivering for, whether that be a state or local jurisdiction, public health departments, or a community-based organization or other organizations that might be recipients of our work.
Oh, that sounds really impressive. So are you able to tell us a little bit more specifically about some of the services or programs that you do maybe with CDC?
Yeah, absolutely. So I can talk a little bit about the CODI project, which has 2 pilots that we've been working on. So CODI, the idea behind it is it's the Clinical and Community Data Initiative. And so our goal within CODI was to be able to connect clinical organizations and community-based organizations so that we can create a sort of place where researchers can go and ask questions about the effectiveness of their interventions or help them understand their populations. So some of the things that we were able to put together as a part of that project is we started off with a pilot in the Denver, Colorado metro area. We were working with Kaiser Permanente, Denver Health, and Colorado Children's Hospital as our clinical organizations. And then we worked with 2 community-based organizations, Hunger Free Colorado, which is they provide navigational assistance for individuals who have food insecurity, and then Girls on the Run of the Rockies, which is a program for young girls that focuses on a lot of aspects of their life, but has a focus on physical activity, helping girls get ready to prepare for and run a 5K. So with that, we worked within that community to build out a data model, a shared data model that researchers could use. And that's based on the PCORNet common data model, but also has some additional aspects to kind of capture that community-based organization piece. And then we also developed an open source record linkage solution that allows us to do what we use a technique called privacy preserving record linkage. So we don't have to share any personally identifiable information on the individuals to do matching. So we don't share any names or addresses or anything like that. We actually use encryption techniques, and there's all sorts of stuff we probably don't. I'm happy to talk your ear off on this. This is probably not the venue for it, but if anyone is interested, I'm always happy to have a conversation on it. But essentially, we can encrypt everybody's information, do matching on the encrypted information so that we can create linkages between this data, but we don't necessarily know who the individual is behind it. And that allows us to do things like tie together observations of BMI for a particular individual with how they may have participated in a physical activity program or whether their household is receiving food assistance. And so that we can then view their full picture to see the effect that these interventions are having. That project has gone forward now and launched another pilot in the Research Triangle region of North Carolina, where we're working with Duke as well as UNC and partners in the area like YMCA of the Triangle, the North Carolina Coalition to End Homelessness, several parks and rec departments within that area to kind of, again, paint that, not only look at food insecurity, but also can we look at housing insecurity? Can we look at how all of this kind of ties together to impact individuals? And there, we're kind of expanding out from just an obesity focus, but can we look at other chronic conditions like hypertension and whatnot to see the impact that these particular programs might have? So the goal there being that these community-based organizations can work to engage with this data set to kind of understand either the effectiveness of their programs or also just kind of understand the data in their particular area. Where should they be targeting services? Where can they outreach? Sort of where are places where they could help deliver that to their community?
That's really fascinating. I love the innovation in this. And certainly, thank you for sharing that. I'm just kind of filled with some questions, but I won't go too far down the rabbit trail on it. But just also thinking how much I'm a huge fan of anytime we can bring together science and innovation and be creative and really on this community level, a lot of information being able to put a story with this data, and the fact that these community organizations can be able to interact with that and let it guide them to next steps, what needs to be created, or if we continue to do what we've been doing, is this working? All of those things I love about what you just described. You mentioned that you primarily work with CDC. Do you have are there other types of clients that you serve as well, or is it pretty much CDC?
So this record linkage work, we wind up working with other organizations as well. So we are currently engaged with HRSA, looking at how some of this record linkage technology could potentially apply to their HIV/AIDS Bureau, particularly their Ryan White program. So they are doing some stuff to understand the effectiveness of that particular program, how that impacts recipients of those services. So we are looking at ways that we could potentially enhance their analytics as well. I'll put in another plug here for some work that I do within MITRE. So MITRE has its own internal research program, and I'm fortunate to work on another project called Cynthia, which is a synthetic patient simulator, and it actually allows us to simulate. And it is open source. It's available to anyone that would like to use it. And that's another thing that we have applied in many other areas, but it allows you to generate populations of individuals that you can use for different analytical purposes. And it's all synthetic. So there's no risk of, it's not de-identified. It's purely synthetic. So there's no risk of re-identification or anything like that. And all of the information in there is fully open source. So it's completely reusable for whatever purposes somebody would like to use it for. And that is something that we've applied in several different places. So the weight trajectory model, it simulates the life of an individual. So the weight trajectories were enhanced under the CODI project to kind of show pediatric weight trajectories going along a little bit better. The work that we did for HRSA that helped us enhance the HIV/AIDS module, so incidence and prevalence of HIV in populations, treatments for that. So it tends to sort of go back and forth between MITRE research that we're able to put into it and then how it sort of spins out and is able to help our government sponsors. But again, that is something that's available to anyone that's listening here. I'm sure we'll be able to put in links after the podcast and folks can go and check that out.
Yeah. Oh, we absolutely will. And I'm very curious about that myself as someone who used to actually, one of my responsibilities as an epidemiologist back in the old days was to estimate incidence and prevalence of patient populations across different countries. But I would have played with this tool along with the hardcore kind of analytics we were putting in place to estimate back in those days. That's really fascinating.
Cool. Thank you.
So I'm going to kind of pivot in to a little bit different part of the conversation where I kind of refer to as connecting the dots. As much as I do identify as being a data nerd and could probably talk for a very long time about just this stuff, I do want to help when I talk about connecting the dots. It's really just helping people who are listening with connecting public health to other industries. And you're such a perfect example of that, having coming from the software background and in public health. But, when we think about this, how does the understanding of public health help you better serve your clients and community and have a greater impact?
I think that there are a lot of aspects of public health that might not necessarily, or even just sort of broadening the scope to health in general, that are not necessarily apparent to folks who are just sort of in the software domain. So I do think that there's a lot that has to do with respecting individuals' privacy when we are speaking about not just health, but public health, and how in a day and age where data is so plentiful, how easy it is to re-identify individuals and how a lot of technology that we have can re-identify individuals, but then there can be a loss of trust. And trust is also something that is very difficult to come by right now. So I think that understanding the public health situation, understanding the position that public health jurisdictions may be in and the level of trust that they may have with the populations that they're serving, and the care that needs to be taken with the data that they are handling and processing, and making sure that that is transparent and that that is treated appropriately. When releasing data, knowing that everyone is going to comb through that and it needs to be bulletproof. That is all, I think, something that took a while to sort of come around to and fully understand as I've sort of come into this community.
I appreciate that so much because, again, you are such an example of what I often bring up on the podcast is, the benefit. Sort of, I think of it as a superpower. You have this expertise in an area of software engineering, and then you are brought into public health. So many years, you're this, have this expertise in public health, and that together is where the superpower lies because you have a much deeper understanding of the population, the ramifications, the implications beyond what you would have otherwise understood just from the science, the software background or perspective or the engineering perspective. I appreciate that. I know we've got a lot of links to gather and some data to gather, make sure because people are probably intrigued from listening at this point and want to know, how do I find out about Cynthia? And we'll make sure we get to that in the show notes, which I'll explain in a little bit. Before we, get to the end, we're kind of wrapping up now. What would be some advice or a tip that you could share with someone who may be listening and also interested in working in your niche?
I would say that one of the great things about software engineering when it comes to public health is just jump right in. It is very easy to find data sets to work with. CDC publishes a ton of data. There are tons of fantastic resources to get working with. So if you're curious about something, there's normally not a whole heck of a lot to stop you from writing up some code, from pulling down some data sets on your laptop, and you'll be kind of surprised at how much you can accomplish in an afternoon or in a weekend, how you can start to tease apart data and maybe gather some insights. So I would say my advice is jump right in, start to take a look at some data. And if you're curious about something, again, there's a wealth of information that's available to you. Just take your question and code it up, see how far you can get. I think we're really lucky in today's day and age that we have such great resources for software developers to get started, but also plentiful data for folks who are curious to get working with.
That's a great bit of advice. And I agree with you. I clearly remember a time when we did not have access to the amount of data that we could sort of play around with or practice with and use to learn these tools and apply these resources. So great tip. Thank you for sharing that. Finally, although we're going to have all of the connection information on the show notes page, but just for someone who's listening, what is the best way for them to connect with you if they want to sit down and have a really long chat about software?
Sure. So I would say either reach out to me on LinkedIn. We'll have the link to my profile there. Or if you're interested in coding, please find me on GitHub and we'll have a link to my GitHub profile there. And all the resources on CODI and Cynthia that you can find on GitHub, we'll have all those linked up as well.
Perfect. Wow. Thank you so much. I really enjoyed our conversation. I know our audience will as well.
Likewise.
This has been great. I look forward to keeping in touch with you as well.
Yeah, same. Thank you so much.
I really hope you enjoyed that conversation as much as I did. I also hope that you found value in the insights that Andy shared with us. I'm excited to share this conversation with you as we continue our series to introduce you to the amazing organization of MITRE and the people who passionately lead the charge every day. I do encourage you to connect with and explore MITRE and learn more about what Andy shared with us on this episode. Now, we have gathered all of the links together in one place on the show notes page to make it really easy for you to access. That includes links to previous episodes in this series where you can listen to the other episodes from different people on the MITRE team if you have not already heard them. So just visit the show notes page for this episode, which is episode 327, and you'll find all the links. Go to phecpodcast.com, and from there, just navigate to episode 327, and you'll find the show notes. One more thing before we go. Please take a moment and share this episode with a friend. we did put a lot of effort into putting together this episode, coordinating the meetings, navigating the conversation to bring this to you on an episode. And I'm sure you know at least one person who would be interested in hearing this conversation. If you're listening right now in one of the podcast apps, then it's really easy to share. You can do that through text or just sharing on a post in social media. Now, if you're at the bottom of the show notes page, you'll find the social media sharing buttons, which make it super easy for you to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.